Good morning, everyone. My name is Rohan Rangi, and my student ID number is 199367552. Today, I'm going to discuss a very common and critical condition known as heart failure. Do you know? More than 100,000 people around the age of 18 and over were diagnosed with heart failure in year 2017 and 18. Thanks to the self-reported data from the Australian Bureau of Statistics that is based on the National Health Survey. This means approximately 0.5% of adult population was affected by heart failure. Heart failure is a very common rationale for hospitalization of adult people in New South Wales. My whole presentation is based on the old lady, Mrs. Brown. In my presentation, I'm going to discuss one clinical manifestation of heart failure with its pathophysiology, followed by one high-priority nursing intervention to cope up with this critical clinical manifestation and to help Mrs. Brown. Mrs. Brown is a 78-year-old female who was brought to the emergency room. She experienced severe dyspnea at 6 a.m. post her sleep. This condition is also known as orthopnea. According to her family, she has a history of heart failure that was diagnosed 2 years before. Heart failure is a chronic condition in which heart is not able to pump blood efficiently. The clinical manifestation of heart failure are pitting edema in arms and legs, dyspnea, arrhythmia, tachycardia, to list a few. Upon admission, Mrs. Brown had high blood pressure, and her blood pressure was 170 upon 95 mm of Hg. Her pulse rate was 120. Her respiration rate was 24, and she was saturating at 85% in room air. She also had bilateral crackles. Upon performing A to G assessment on Mrs. Brown, we found out her airway is patent. During the assessment of her breathing, we diagnosed she had severe dyspnea. The diagnosis of acute exacerbation of heart failure was also made. Dyspnea, also known as shortness of breath, is a common clinical manifestation of heart failure. The pathophysiology of dyspnea is considered very complex. In heart failure, dyspnea is related to the fluid buildup in the air sacs of the lungs. This is also known as pulmonary edema or interstitial edema. Due to the damage of heart muscles in heart failure, the contractility of ventricles is decreased. This causes low cardiac output and the backflow of blood in the lungs. Furthermore, the juxtacapillary receptors, also known as J receptors or C fiber receptors that are located within the alveolar walls, detect this pulmonary edema. The stretch receptors present in major veins like pulmonary vein detect the bronchoconstriction in the lungs. Then, signals from the medulla of the brain are sent down to the respiratory muscles, most importantly, the diaphragm. The afferent signal, efferent signal, and the central information processing of the brain all play a vital role in dyspnea. When the efferent signal and the afferent signal do not match, dyspnea occurs. Moreover, stagnant hypoxia or prolonged hypoxia, a condition in which there is not enough blood available to the blood tissues, body tissues, may cause dyspnea. This occurs due to the activation of specific receptors or chemoreceptors in the medulla of the brain, which leads to dyspnea. As a nurse, there are many nursing interventions that we can perform to take care of the patient who is having dyspnea. To list a few, we can make sure the patient is in the rhesus room with all available oxygen equipments. We can put him in Fowler's position and majorly concentrate on supplementary oxygen therapy. As from this paragraph, we all can say the high priority nursing intervention would be oxygen therapy. As Mrs. Brown is saturating at 85% in room air, which is severely low, we can perform oxygen therapy. According to some studies, supplementary oxygen therapy has been used as a treatment measure for treating people with heart failure for about a century now. As a nurse, we can put her on Hudson mask with maximum oxygen, that is 10 liters, which can either be reduced or increased depending on her new saturation levels. Oxygen therapy will help Mrs. Brown to increase the amount of oxygen delivered to the body tissues, reducing the workload on her heart. When the workload on the heart will be decreased, it will also help to relieve some pressure on the respiratory system. And it will not only maintain the saturation levels, but also help in reducing the tachycardia and tachypnea, thus maintaining the vital signs. To put everything in a nutshell, today in this presentation, I have discussed the history of a 78-year-old all-female Mrs. Brown, who was brought to the emergency room. She was diagnosed with acute heart failure, which is a condition in which heart does not pump enough blood. Moreover, she had severe dyspnea or breathlessness, which is caused by stagnant hypoxia and fluid buildup in the air sacs of the lungs, also known as pulmonary edema. Then I discussed supplementary oxygen therapy as one of the high priority nursing intervention that we can use to treat the severe dyspnea and ease patients' condition. Thank you and have a great day.